management is responsible for. What are some of the most resources that patients should be aware of that can be offered through case management?
Mm-hmm.
And what are some of the most underutilized resources that case management offers, and why do you think they're underutilized?
The resource to me is knowledge. Because a lot of times people come into the hospital and they're very guarded. Um, you know, it's a bad day in their life depending on what setting you're working in. If you work at L&D, it may not be that way. But for the most part, you have unexpected illness, sickness, injury, you're worried about money, you're not in your right mind.
Right.
So basically I feel like the number one resource that people don't utilize is asking for the case manager in general. They
Yeah.
don't, because they don't know what they do, you
Right.
know. And then when it comes to discharge, it's like the nurse is calling you like the patient doesn't have a place to stay, they can't get their medications, they didn't do this, they can't get this, they don't have to ride home. You like, y'all should have been called me. But because the patients, they're very guarded, they don't want to be judged, or they don't want to feel like they're getting a handout, um they don't ask for help, or they
Right.
don't ask for anything. And then you have the other patients on the other hand who ask for everything, that is not even within this admission.
Mm-hmm.
Again, you come in with a stomach ache, you're telling me that you can't get your mental health medication filled.
Right.
How long has this been going on? 8 months. This is an acute care hot, meaning right now. What's going on with you right now? Let me help you with what's going on right now.
Yeah.
So I think the knowledge is the part. I think a lot of people don't want to be judged, so they just don't ask for help. Again, the hospital that I learned how to be a case manager at, it was a urban core hospital. It was the city hospital, but they had the affiliation with a big university where I was from. And so they treated all types of patients, and they had all types of resources. If you don't even have to ask. You
Mm-hmm.
can just mention to a case manager that, hey, I keep getting admitted because I can't get my prescriptions filled.
Right.
That's gonna prompt them to say,